joined by Miriam Delphin-Brittman and Vanessa Durantes, who look after our kids, look after adults, mental health. And I'll tell you why. I'm going to show you some relatively good COVID metrics trending in the right direction that give us some good comfort. But we're also reminded with Miriam here and Vanessa here that we still have some healing to do. And a lot of stress that's been put upon our kids and our families, and what we should do about it and what we are trying to do about that. First, let me just say that we're still doing a lot of testing. We're making sure that's our early warning system, gives us a lot of indication of where the infections are. The positivity rate is low, 2%. That's not zero, but it's the lowest it's been in a number of weeks, and that's incredibly positive. Hospitalizations down, you know, that is something we trend a lot, and fatalities, thankfully, in single digits, more than we need, but 6 is all within a band that says we're slowly getting back to our new normal and the vaccinations are working. But that's not good enough. We see around the world and we see around the country that there are hot spots. And that from those hot spots, you know, small brush fires can happen. And as I look around the state of Connecticut, we put together this eye chart for you. Josh did this. This is case rates by town. And I can just tell you in a nutshell that the darker the color, the more infection you have. And it's just worth noting as you look at this that there's some trend lines. You can see sort of the more southwest area of the state is a little hotter, maybe a little bit related to the New York variant, you know, coming up. You may be wondering what's the darkest town there, and that's Waterbury. And you know, Waterbury can have a case rate that's you know, twice as high as what you see in eastern Connecticut. A lot of that is related a bit to the Naugatuck Valley. North Canaan, Thomaston, other towns that you see a slightly higher infection rate. We're bringing the Griffin vans there. I don't want to see any vaccine left at the end of the day. It's really important. So make a mental note of this, because this next chart is the mirror, is the opposite. This is the vaccination rates by town. And here, it's the darker, the better. The darker the color, the more likely it is that people have been vaccinated. You can probably see, if you can remember, you know, Waterbury, unfortunately, has a lot less likely folks to have been vaccinated. You see along the shoreline there, Lyme is our champion. Old Lyme, 75% of the people, not 75% of the adults, 75% of everybody has been vaccinated. I mean, they're really close to herd immunity there. Old Saybrook. A special shout out to the Connecticut River Health District. A lot of these health, you know, local health departments are making an enormous difference, and you can see that sort of on this region. So, if nothing else, this reminds you there's great variability town to town and region to region, both in terms of percentage vaccinated, it could be a factor of 2, and also what that means in terms of infections. We're getting closer. I really want to deal with those places that have the highest infection, make sure we do everything we can to keep them safe, because that keeps the rest of our region safe. Anyway, here's the vaccine update. I'm proud to say that my age group, 65 and above, is breaking all records with 87% have now been vaccinated, 87%. And let me tell you why I think that's important. You maybe remember 3-4 months ago, oh my God, 50% of people say they don't want to get vaccinated, they don't know, they're hesitant, they're not going to do it. Well, if the 65 and above, where we've had the vaccines available the longest, are a leading indicator of anything, 87% is darn close to a real herd immunity. And if we can replicate what we do in the older demographic, 65 and above, if we get that to the rest of the state, get those 16 to 44-year-olds up there, we're going to have a really nice summer. So that's what we got to continue to work on. And in defense of the 16 to 44-year-olds, they've only had the vaccine available to them for 2 weeks. So give them time to catch up. But we want to catch up. It's really important. We have continued strong demand across all age groups. I want to keep that going. But, last week we had 288,000 doses. A lot of that was related to J&J. The J&J has been temporarily paused or pulled from the market. So this week we've only had 179,000 doses available. Overall, 1 million of our folks have been fully vaccinated. That's great, but that means, remember, that there are 2.5 million who have not yet been fully vaccinated, which is why I have to urge you to be careful a little bit longer. J&J update, just for your information, the pause has had little impact on our Connecticut mobile vaccination efforts. That's good news so far. But there is pretty good supply out there. Josh said you could have made calls this morning, gone online this morning on vans, and been able to get an appointment. Again, some of our vans at the end of the day, today's a little rainy, so it may not be indicative of everything. There are vaccines available. Walk up and get your shot. It's well worth doing. Appointments are available, ct.gov, COVID vaccine, or the phone number, for those of you more old-fashioned, 877-918-2224. But you can walk up to a lot of these mobile vans right now and get that vaccination. It's easy to do. There was a little bit of discussion about this the last few days when the CDC and the FDA pulled J&J due to as Dr. Fauci said, less than 1 in a million chance that the J&J vaccine could result in a rare clot. That's less than 1 million. And then the inverse of that is Alex's piece in the Hartford Courant, who is being hospitalized with COVID-19, almost exclusively unvaccinated people, which means vaccinated people are, it's working. And it just reminds you that in life, everybody always talks about the risks of doing something. They don't spend enough time talking about the risks of not doing something. In this case, it's the risk of not getting vaccinated. And I think that's what this chart shows as a contrast. With that, let me introduce you again, back by popular demand, to Vanessa Durantes. She cares for the kids who otherwise may not have a family, and works every day to make sure their lives are better. And as you know, was helping us out as we thought about immigrant kids as well. So Vanessa, tell us what you're seeing in terms of the stress some of our kids are going through.
Thank you so much, Governor. And, just want to make sure everyone remembers that DCF is a consolidated child welfare jurisdiction. So along with the Child Protective Services piece of who we are also responsible for children's behavioral health. So when we think about the impact of this kind of imperfect storm that we have been in over the last year, it's really important to pay attention to children in the context of their families and in the context of supporting their communities. And, we know that families have needed tangible supports like food and, housing and all of those other things that lead to, without them, stressors that children actually experience through their parents and through their families sometimes. So when we think about mental health, we think about it across a lifespan. It starts with infant mental health, as, the little ones can experience stress through their parents. And then it goes on to the early care and supports that we hear Commissioner Bai talk about all the time. Then we think about our young school-age children who have been isolated and separated from their teachers or their friends for quite some time, and that's kind of been unsteady. And now that everything is kind of coming back online with the vaccines and fewer restrictions, and as much as we stay vigilant, our kids have been experiencing tremendous social isolation. So it's important for us to pay attention as we support them. You kind of move across the lifespan to our teens and adolescents. And, I have to give a shout out to the Connecticut Suicide Advisory Board, who has been following very closely the mental health needs of our teens and adolescents. The Connecticut Hospital Association is a great partner with us as we think about the impact to children and, presentment to emergency departments. The Office of the Child Advocate has been working very closely to, really monitor the mental health and behavioral behavioral health needs of teens and adolescents. I also want to recognize that there are, communities that support children with specialized needs also have been reporting an increase in behavioral health or concerns about the mental health needs of special populations. So, I'm so glad that you gave us space to talk about mental health, throughout the pandemic, because it's time to lift the stigma. Mental wellness is healthcare. And as we think about the importance of the recovery from this pandemic, we have to think about emotional recovery of using the supports of our families, our friends, our neighbors, and then the more formal supports that our communities can receive. One of the best ways to access supports is through 211. United Way has been a giant in this space throughout the pandemic. 211 is access to emergency mobile psych supports and all of the other types of supports that can connect families to our tremendous array of our nonprofit providers and stakeholders and communities. Our private nonprofits have been absolutely phenomenal across the pandemic, and whether it's in telehealth or in-person responses to respond to citizens that are in crisis, and more importantly, to help parents support the safety of children and their own mental health needs. So, I want to make sure that we thank our mental health, our provider partners for kind of being there right with us throughout this unprecedented time. And so when I think about the transition of the lifespan from our little kids through to our teenagers, I then hand off to young adult services, which are usually handled most efficiently by DEMIS. And so my partner in government and the other half of this mental health lifespan is Commissioner Miriam Delphin-Rittman, who can talk about some of the things that Connecticut has done to lift up services related to mental health on the broader spectrum. Miriam?
Yeah, thank you so much, Commissioner, and thank you, Governor, for the invitation to be here. Yeah, I also want to, start by just thanking our providers that have been just so just active and right there throughout the pandemic in terms of being able to address the mental health and substance use needs that people are experiencing and really challenged with through the pandemic. So really want to give them a shout out for the work that they've done, whether it's connecting with some of our young adults through telehealth or having in-person appointments as well. One thing that we know for sure is that across Connecticut, behavioral health, whether it's mental health or addiction services, have remained available, and providers have remained open throughout the pandemic. And so really want to acknowledge their good work and thank them for their efforts. One thing we continue to hear, and Commissioner, you mentioned this as well, is that this pandemic in many ways has been a collective trauma. And so people we're hearing are still experiencing the impacts and the ripple effects of going through this past year, whether there's disruptions in family relationships or disruptions in connections with friends, or mourning the loss of a loved one. We're hearing that quite a bit, that many individuals are mourning the loss of their loved ones, or worrying about one's own health or the health of a family member. And so there's a program that I want to share about and want people to know about that is active in the state. Thankfully, we receive resources from FEMA and also SAMHSA. This is our crisis counseling program. This program is available for all Connecticut residents. And so anybody who is struggling can call 211. We have hired 40 crisis counselors that are available statewide to assist people. The counselors can be accessed through 211 or also through the CT Stronger website. And there are numbers there to also connect to the crisis counseling program. Again, it's available for anybody, but there also is a focus on older individuals living in congregate care settings, or people who may be experiencing homelessness and may be in any of the hotels or shelters that we have around the state. Or faith communities. We've done quite a bit to connect with faith communities around the state, and there are crisis counselors that are actually embedded and working in faith communities as well. So just want to let people know about those services and supports. It's certainly over the last year, what we're hearing is that increasingly paying attention to mental health is so crucial. And so I want people to know that services and supports are available. If people are struggling, they don't have to struggle alone. Do reach out. because help is available. So thank you. I'll turn it back over to you, Governor.
Thanks, Miriam and Vanessa. And we did a program this morning. It's called LEAP. And while our schools are more likely to be open than just about any schools in the country, a lot of our kids still are not going to school. And we're talking to the superintendents today, and the LEAP programmers are knocking on doors or making the phone call, urging these kids to get back. And Miriam, you just reminded me the trauma that some of these kids have been through over the last year. Maybe they lost someone that they really cared about, and it was very close to home, or the stress that they're feeling at home. A lot of reasons we're trying our best to encourage these kids to come back. So thank you for what you're doing. And of course, Josh and Paul are here as well.
Fox 61.
Hi, Governor. My first question will actually be for you. There were some senators and lawmakers. They gathered at the Capitol yesterday to address the spike in gun violence throughout major cities such as Hartford, and they're requesting funds from the state for violence prevention programs. What are your thoughts and what's being done?
Well, a lot is being done on that. First of all, we've done a lot in terms of prevention. We've worked a lot with all of our different municipalities, not just in terms of overtime for police, but really in terms, again, in terms of mental health, project longevity, any of those not-for-profit programs within those different communities we're able to provide funding for. And as Miriam can say, again, with the help coming from the feds, we've got additional resources going to all of our mental health providers, just so we can do a better job at the origin.
Yeah, absolutely. I mean, if I can add to that, Governor, one of the programs that that we're in the process of expanding is our mobile crisis. So if there are individuals that are in crisis and are struggling, they can call 211. And the crisis teams will go out and assess them and help to connect them to whatever services and supports that are needed that are available. And so that certainly is a program that's available through 211 as well.
Thank you. And then, Governor, final question. Once we hit that percentage, I believe you said it was 60% of residents being vaccinated in Connecticut. Do you already know what changes you would have in place or like certain limits that would be lifted, or is that to be decided?
No, I think for younger people, maybe in and around bars and nightclubs and rock concerts, those are things that we're still a little more limited on. And we got that cohort of people more vaccinated, so they began to get closer to herd immunity. I think those are the things that we'd be able to open up.
Channel 3 Eyewitness News.
Governor, as we look at the vaccination rates by town map, does this highlight the problem that the state is having with equity and getting it into the SBI towns? Or is this just a matter of vaccine hesitancy at this point?
Well, I think I'll start with this and then hand it over to Josh. I think you can see from that map that often it's in the cities where we have a little more hesitancy and real access problems. We got to continue to do a really good job there and make an extra effort. But you also see in some of our rural areas, you can have a town that very heavily vaccinated next to one that's less so. So there are some cultural things and local departments of public health, but we've got to emphasize it's in the interest of the entire state, the entire community, to make sure that nobody gets left behind.
And going back to what you mentioned earlier with the majority of hospitalizations being amongst the unvaccinated people, how do you incorporate that into the messaging now that demand may be waning in our state?
We can just show you it works. We can show you town by town that the correlation between vaccination and infections is direct. We can show you in terms of hospitalizations, those that are older are not being hospitalized at this point. It's just younger people there. We've got to do a better job, Matthew, of continuing to get our mobile vans bring the vaccine to you. I was Josh reminded me, because with no J&J, we had to change out the vaccines in the mobile vans, and we had our amazing Connecticut National Guard back and forth across the state, getting the J&J out, putting in the Pfizer and Moderna, getting those vans out to people. We just got ourselves a second mobile van. And that second mobile van, you know what it's going to do? Go 3 weeks later after the first mobile van went through so you can get your second shot. It's a little more complicated than it was a week ago. We're still getting it done with a special emphasis upon equity.
And Governor, I want to just add, you were shouting out your age group. My age group is picking up. I got my second shot yesterday, so it's important to have those credible messengers out there. I feel great today, and I feel like I have a suit of armor on.
You're catching up.
My final one, if I may. Wesleyan, they were the first Connecticut university to require the vaccine. Where do the talks on the state level stand right now for our state-run colleges?
Right now, we're leaving it up to the colleges, the not-for-profits, the local businesses. They can make the determination in terms of how they want to use the vaccinations or a notice that you have been vaccinated. I think that's going to be our priority for the near term. But we're watching carefully. You're right. Rutgers, a lot of other universities, they've said, I want people vaccinated coming back. All of our universities already have a whole series of vaccination protocols for people to go back. We're going to leave that up to them for now to determine what they want to do in the COVID vaccine.
NBC Connecticut.
Hello, Mr. Governor. A question today. We were at a vaccine clinic in Hartford, a walk-up clinic. No appointments were necessary. And we saw that it was very sparsely attended. And we realized that this is probably the exception or the rule as it relates to vaccine clinics around the state, where we've been to many that have been extremely busy. But we are curious as to why you think that may be, that some clinics are now having lighter attendance. You alluded to the fact that maybe at one point we'll achieve a state where there's less demand for the vaccine. Have we gotten there yet? Is that part of the equation right now?
I'll start and then pass it to Josh. But look, I think a lot of the worried well, those that were sitting there hitting the refresh button at 12:01, those that walked up because it was really easy, maybe they've gotten vaccinated. And this next group of people, the next 20 to 30%, we're going to have to work a little harder to make it easier for them to get vaccinated. I can tell you that in those walk-up clinics, people are knocking on doors, they're making the phone calls, they got friends telling friends, I got vaccinated, you should too. What else are we not doing, Josh?
Well, I think it's worth pointing out it's also a cold, rainy day in Hartford, so outdoor walk-up clinics may not see their best business today. But we are also working with all of our local partners to make sure we get the word out for these clinics. That's a critical component to this. We have had great turnout at a lot of the walk-up clinics in Hartford. They're making great progress here, so I wouldn't read too much into that one.
Thank you.
News 12 Connecticut.
Good afternoon, Governor Lamont. Today, a report came out that the CEO of Pfizer said a third COVID vaccine dose is likely needed. Is your administration shocked by this and about a potential annual boosters that may be needed? And how will Connecticut handle giving out a third dose?
I don't think I'm shocked. I mean, we've been having annual flu vaccines since I was a kid. And we've certainly talked to the Pfizer and Moderna and J&J about how with these different variants, how they can customize the booster shot depending on the nature of the virus that may be in one community or one state versus another. So I think it may be something that's with us for a while, but it's still a wait and see.
News 8.
Governor, it just came out of New Hampshire, word that the governor will drop the mask mandate there, I believe Friday. Your reaction to that, and is that something you're not even thinking about here until, we're as close to 0% positivity as possible?
I think it's premature. I think that we have 2.5 million people who haven't been fully vaccinated. I think we'll be in a much stronger position in 30 days than we are today. And even if it's a small group of people who are unvaccinated, every time they get infected, there's one more chance for this variant to mutate again. And that every mutation is another risk. So I'd like to think we as a region, we as a nation, work together to make sure we limit the possible transmission of this virus as much as we can.
Is there possibly something to take out of what's happened in Old Saybrook? I mean, obviously it means a lot of people have gotten vaccinated, but are they going about things differently? Are they doing something specific that maybe the rest of us can learn from, because their numbers, as you pointed out, are outstanding?
What do you think, Josh? That's more your neck of the woods.
Well, look, I think as the governor mentioned, he gave a shout out to the health department there, also Ledge Light Health District right on the other side of the river there. They've been very active. They've been doing a great job. It's also communities that skew a little older, so they've had a little bit of a head start here. But I think it's what we're seeing works really well is strong partnerships between local health, hospitals, pharmacies, and our federally qualified health centers, where it's teamwork in each of these communities with support from the State Department of Public Health, where we're bringing mobile units, we're doing canvassing, door knocking, outbound calling. That's how we get these numbers up. And to the prior question as well, I mean, we still continue to see strong demand in a lot of these other communities where the rates are lower. So our work is still very much in front of us, and we're optimistic we'll continue to drive the rates up in the rest of those towns in the coming weeks.
WTIC 1080 News.
Hi, what's the latest from the feds on the Johnson & Johnson suspension, and will we see a comeback this week or next?
I don't think we quite know yet, Dave. They were saying it's probably going to be more measured in days than weeks. That was what they told us a few days ago. I think they're going to continue testing a little bit longer.
And are you still disappointed with the situation?
No, I'm not disappointed by the situation. We'd like to get the J&J back, but I want to do it in a way that everybody has total confidence that these vaccines are safe and effective.
I want to ask about gun violence in the cities. I want to ask you about something that happened in the suburbs the other day in Brantford. Very little has been said or released about this, maybe because just one person got shot and should be okay. But especially in the state of Sandy Hook, should people still be worried about stray bullets coming from anywhere, from just anyone who can get a machine gun?
Yeah. It's a rare occurrence, but there are unstable people out there who have too easy access to firearms. It's the craziest thing we do as a society. I can't figure it out. And in this case, sadly, this person took his own life but didn't take anybody else's life. But it reminds you, civilization has got a thin veneer, and we really got to work hard to take some of these temptations off the table, and that includes guns in the hands of people who are unstable.
Real quick, have you been given any idea of how many shots were fired? Because that apparently is top secret information.
Paul, do you have any top secret information?
If I did, I wouldn't be able to provide to you at this time. But at this time, I know the investigation is still ongoing, and as there's more to be provided, it will come out of the state police and Commissioner Ravella and Colonel Malikis.
Witness said 200 to 300. Thanks.
The Waterbury.
Oops, I'm sorry, Max. Governor, I would just also mention, because there was a piece of that alluded to Sandy Hook, and Connecticut does not ever forget that tragedy. We started today's conversation on discussing mental health, and the Children's Behavioral Health Plan was born out of the Sandy Hook tragedy. It has been updated ever since, and now we have focused our attention in really building up children's behavioral health to include the incidences of, the things that we've been talking about here today that have kind of influenced children's behavioral health services across the state of Connecticut. So I think it's right to kind of help make sure we keep this conversation going.
Thank you.
The Waterbury Republican American.
Thanks, Max. Governor, this information might be lagging a week behind, but the latest data shows 51.5% of whites have received a first vaccine shot. A third, 33%, almost 33% are fully vaccinated. This compares to roughly rates of 28 and 14% for Blacks and Hispanics each. So how does this continuing gap reflect on the state's efforts to reduce ethnic and racial disparities? Don't these statistics show minority populations are still being left behind?
Shows that we got to work harder at it, Paul. There's no question about it. We've got 35 vans taking the vaccine right to people. We're working with the religious community and other trusted advocates. I got vaccinated in the historically Black church, trying to do everything I can to convince people this is the right thing to do, not just for you, but for your community. And we're not going to stop until everybody has that opportunity to get vaccinated.
But still, when you look at Waterbury, I think it was, I don't have the map in front of me right now, but, it looked like, some surrounding towns, I think it was in the 30% or near 40% for Waterbury, and some surrounding suburbs are up to 60% in terms of vaccinations. That's a significant disparity.
It's a significant disparity, and some of that's related to access, Paul. Some of that is related to hesitancy. I'm doing everything I can to get the best people in the community who are trusted advocates to get people to get vaccinated. And I'll take any other ideas or any other people we should be reaching out to tell them how important this is.
And there was, I guess, a jump of almost or around in the neighborhood of 600 new additional cases of variants here in Connecticut. Almost 300 more cases of the B117 variant. One, do we know how many people are being hospitalized or have died as a result of an infection from one of these variants? And two, what's the concern? What are you guys, are there any projections about how, where we stand in terms of, I think it was last time, I think it was 40% of cases were these variants? Or
yeah, it could be as high as 50% now, Paul. The B117, the bad news is it's highly infectious. So while we have over half of our population has been vaccinated, it's still spreading fast in the other half of the population. The good news is the vaccines work. And it works against this variant.
But do we know, do we have any information in terms of, I don't know if Josh knows it or DPH, do we know how many people have been hospitalized and died as a result of an infection from one of these variants?
You know that, Josh?
No, I mean, not every person who's hospitalized has a sequence, a genomic sequence done to determine that, Paul, but the most important point is what the governor said at the end is what's common about almost everybody who's being hospitalized right now is that they were not vaccinated. And these vaccines work against these variants very effectively. So if it's a topic you're concerned about, my recommendation is go get vaccinated because you will almost certainly have very robust protection against severe illness that would land you in the hospital.
Okay, and on an unrelated subject, Governor, have you contacted the White House with a recommendation regarding the possible use of the Connecticut Juvenile Training School for migrant children?
Yeah, Paul Mounds was talking to the White House as recently as last night, talking through some of our potential plans if they had a real need with these young kids, how we could take care of them in a humane way. And at this point, I think the White House said, let's take a pause. I think we're taking care of these kids elsewhere right now, but we really appreciate the heart of the state of Connecticut to reach out and give us some options.
Okay, so no relocations of these children and teenagers in the foreseeable future here, then?
That's right. They didn't. They said they're all set for now.
Okay, thank you very much.
The Associated Press.
Thanks, Max. Good afternoon, everyone. Governor, I had a couple questions about the LEAP education program. Will the summer programs be mandatory for some kids? And what's the participation level that you're expecting? And who will run the summer programs?
I've learned, Sue, that mandatory and mandates are not that popular. But I do find that we're going to go knocking on doors as part of this LEAP program, where we're going to tell these kids who haven't been in school in some cases for 7, 8, or 9 months, come to school. You got 2 months left. Your friends really miss you. And by the way, we've got this amazing summer learning program available right in your community at no cost to you or your family. And here's another opportunity for you to come back, have some fun, do some learning, and be ready for September. What was the second part of your question?
What's the participation level you're expecting, and who is going to run the programs? Will it be the regional education service centers?
We're going to be rolling that out, I think, in the next week or so. And it's guidance to the superintendents. We're going to provide some money. We're going to make deals with, museums and libraries and aquariums so that the kids can have some free access. And then working with Boys and Girls Clubs and WISE and existing camps and other places help set up, programs. Maybe provide some apprentice counselors there as well, so these kids have a mentor and somebody they can talk to.
Great. And yesterday, the nursing home industry warned about the ramifications and the possibility that we could have strikes at 52 nursing homes, many of which are still struggling financially because of COVID and lower occupancy rates. Is there anything that your administration is doing to try to prevent this from happening?
Yeah, that'd be terrible. I mean, we got, hundreds of millions of additional dollars to the nursing homes, last year as part of, COVID relief. Our nursing homes, they are right on the front lines. I appreciate that. They stayed open. Sometimes they did not have all the, masks and PPE that they needed. We prioritized that. We prioritized testing there. We prioritized everybody getting vaccinated there. We made sure that in terms of some of the federal and state support we gave to the nursing homes, a lot of that money went right to those frontline workers, $500 to $1,000 bonuses. So I'd like to think we can avoid a strike and like to think we can work together on this and take care of our seniors in this time of need.
Is there anything that your administration is doing right now to try to work with the negotiations that are going on right now? Maybe try to increase Medicaid reimbursement rates, anything like that to stem this off?
Paul, do you know about that?
Yeah, we're like, as the governor stated, we are aware of the strike notices that have gone out. As processed, they have to alert DPH. Department of, OPM, working with DSS, like I said, we are looking at various options at this time. Obviously, as you know, those negotiations are ongoing between those particular unions with the particular nursing homes. Obviously, during that time, they will look for any type of increase in reimbursement from the state, but we're going to be evaluating that very closely, especially now we're in this crux of the budget process.
Thanks. And one quick question regarding the J&J pause. Do we have any idea how many people who were scheduled for J&J this week just didn't make another appointment for Pfizer or Moderna?
Josh?
No, we don't. What we do know, though, is that the vast majority of the Johnson & Johnson appointments that were scheduled for this week, our providers did a great job of quickly switching those over to Pfizer or Moderna, and saw very little fall off in terms of those appointments. Now, some of these mobile units were going to be walk-ups, and we know there have been a small number of cancellations, particularly at some of the smaller pharmacies, but thanks to the heroics of our providers, our National Guard, who were, as the governor said, shuttling doses around the state yesterday, we think the number of cancellations was pretty minimal.
And that other mobile unit is a FEMA unit? Okay.
That's correct. It's a second FEMA unit, which, as the governor said, is going to essentially shadow the itinerary of the first FEMA mobile unit around the state 3 to 4 weeks later to pick up those second dose appointments.
Great. Thanks. Thanks for taking up. Sorry to take up so much time.
It's fine, Sue. The Day of New London.
Hi, everyone. I want to follow up on that question.
What's going to happen with the Griffin vans? I know you just said the FEMA van's going to come by for a second dose. How's that going to work?
Same play. So the DPH Griffin vans are going to go back to the same location they were at, 3 weeks later for Pfizer, 4 weeks later for Moderna, and try and reach out and set appointments with the people who are there for the first doses as well.
Thank you.
CT News Junkie.
Thanks, Max. Hi, everybody. Governor, in response to an earlier question, you on the New Hampshire mask requirement, I think you said we'd be in a much stronger place in 30 days or so. Is it sort of plausible to read into that if vaccinations continue at the current clip that like we would be in a situation a month or so from now to talk about lifting our mandate?
Yeah, I would say that's true. I mean, you probably think about indoors versus outdoors, and outdoors is a place where it's a lot safer. You probably say indoors, you probably want to be stricter until you have a vast majority of your people who are vaccinated. Hugh, maybe you go from a mandate to guidance. It's still the right thing to do. I think stores would have the opportunity to say, unlike in Florida, we feel better if people wear a mask indoors through the month of June. So we'll feel our way. Let's first get up to closer to herd immunity.
Okay. Another question, a bill that would eliminate the religious exemption on school kids' vaccinations made it out of a second committee today. I understand that legislative leaders want to raise it for a vote within the next couple of weeks or so. If that bill landed on your desk, would that be a thing you'd sign?
Yeah, it'd be something I would sign.
Okay. Thank you.
The Hartford Current.
Hey everybody, this is Emily from The Current. First thing, because it is Thursday, Josh, do you have those SBI targets?
Yes. So for the most recent week, we improved 3 percentage points in terms of our percentage of vaccines that are being administered to residents of those high SBI zip codes. So it's still short of our goal of 31%, but moved up 3 percentage points since last week.
And could you give me the date range of that week? And do you also have the provider breakdown?
Sure. The date range is April 4th to 10th. And it's 27% for hospitals, 22% for local health departments, 29% for federally qualified health centers, and 18% for pharmacies.
Okay, great. Thank you. And then I also wanted to ask a couple more points of clarification on the second doses from those mobile vans. So for somebody who gets their first dose of either Pfizer or Moderna at one of the mobile vans, will they be told like right then when the van will be back around? Will they essentially have an appointment made for 3 or 4 weeks out?
Yeah, the teams are in the process of working that into the process right now. For people yesterday or today, that may not have happened in every case, but we have their contact information, and if necessary, they'll be reached out to make sure they know when to come for their second appointment.
And then what about people who maybe aren't able to make it on that one day that the van is back at the same location? Like, if you're going to a physical site, you can schedule your second dose for like 3 weeks and 1 day out if you happen to be working on the exact 3-week mark or something like that. So I guess what should patients expect to do if they just can't make that one day that the van is back at the same spot?
Yeah, so it's a great question. And the good news is, 3 to 4 weeks from now, we're anticipating that we will have significantly more supply than demand in Connecticut. And as a function of that, as well as a function of the governor's strategy to provide second dose appointments available for college students who are coming back from out of state for the summer, we're anticipating having an abundance of second dose clinics available as we get into May. So if that second dose appointment at the mobile clinic doesn't work for someone, there should be plenty of other options available to them.
And last thing, how many of those Griffin mobile vans are on the road as of right now?
As of right now, there's 13 and ramping up to 35 by the end of the month.
Okay. All right, great. Thank you, everybody.
Hearst, Connecticut Media.
Hi, Governor. Julia Bergman with Hearst. I know it's too soon to tell whether the J&J pause is affecting vaccine hesitancy, but going forward, what would be an indicator to you that that would be happening? Would it be people not rescheduling their appointments who had signed up for J&J, or, you know, consistently low turnout at the mobile clinics?
Yeah, I think you sort of answered your own question. People canceling and not rescheduling something else. We haven't seen that as yet, thankfully. And we do have plenty of supplies, so come on down.
And the J&J vaccine can be stored for 3 months, is that correct? So is the plan to store the doses right now?
The plan is to store the doses right now, and they store, we keep refrigerated, and if we get the green light again, we'll see what the appetite is for J&J. It was very popular up until a few days ago because you were one and done. It was easy to do.
And lastly, just wanted to ask you about vaccination rates, particularly those among 16 to 24-year-olds. Is that sort of the rate there what you expected at this point, 2 weeks after that age group became eligible?
I think so. I mean, it's only been a couple of weeks, and we went from very low to 34%, 16 to 44, that is. But I have a feeling we're going to have to work harder with the younger demographic, just like we had to work harder to get them health insurance as well.
The Connecticut Mirror. The Connecticut Mirror.
There we go. Can you hear me now? Yeah. You're down from 288,000 to 179,000 doses, but yet the governor, you just said we do have plenty of supply. So can you square those two things? Is this, you have plenty of supply just in this short period that you've been able to switch things around? Or is the demand waning that quickly?
Let's see if I can square that circle as best I can. I mean, what I can tell you, Paz, is that it appears that there's a pretty short duration between we get the vaccines out, you can make a call, you can get an appointment, you can get an appointment in a reasonably short period of time. We're finding our vaccine vans as they go around. There's still pretty good demand there, but they're not running out quite as quickly. You're asking, is that a demand issue, or maybe we're just in the later stages of this? I think I got to get back to you on that.
Well, let me ask a different way. At what point do you feel the impact of being down 35% in what you had been getting? At what point do you have to make decisions about prioritizing allocations as to who's going to get it? Or again, are we now entering a point where maybe, again, the demand just isn't there?
Well, we have, 55% of our folks over 16 have been vaccinated, so it's a smaller cohort than you certainly had a month ago. And it's probably a cohort that feels a little less urgency to get vaccinated. So maybe this sorts itself out. I really hope that the J&J is back on the market by early next week, and that we can speed things up.
If you do get to the point, not if, when you get to the point where demand is slacking and there's still significant pockets of unvaccinated people, is there another plan in place? Or is it just you're going to continue to do what you've been doing, which is trying to get trusted people in those various communities to put out the word?
Well, in our last briefing, we're sort of teasing a little bit about the type of incentives that other places are using, as opposed to mandates incentives. China, they give you an ice cream cone. Here you get a Krispy Kreme donut. A shot for a shot was in one town where they had the bars open. So my instinct is there'll be some incentives out there. It very could possibly be, Paz, that you're going to have stores and restaurants that say we feel more comfortable only having a vaccinated people coming in there, and that'll be one more incentive for more people to get vaccinated. I'd like to think it's going to sort itself out with incentives and on a voluntary basis, and you telling your friends it's time for you to get vaccinated.
Are you surprised that again, being down 35%, it's not been more of a problem so far? I mean, that is a little puzzling, I have to say.
Well, to be clear, Paz, if we had the Johnson & Johnson this week or we had more supply, we could vaccinate more people this week. There's people who have appointments right now for next week, for the week after, that could have been brought forward. But part of the strategy we have with our providers is we schedule out a baseline, and then as additional supply becomes visible, they add more appointments. That's why as you look back over the last several months, even as we open up new phases, there's often new appointments being added almost every day as providers get visibility to that additional inventory. We just haven't been able to add as many additional appointments this week because we weren't able to use the J&J, and we didn't get more from the federal government. But we've been able to balance with the appointments that we did have scheduled as a result of the inventory that we do have, as the governor referenced. So we'll still get there. We're still making great progress, moving fast, still have strong demand signals. But you're right, the work will get harder as we get into the end of April and into May, when we will have more supply than demand.
Thank you.
All right, I'm getting a signal here. There are a couple of questions about masks, New Hampshire. Just remember, the masks are not just about keeping you safe, but showing respect and keeping those around you safe as well. And I think it's the same thing as we think about mental health and distress and some of the stress that people have been through over this last year. Continue to look out for each other, just like Miriam and Vanessa do every day. Thanks, everybody.